Hi, this is Dr. Randy Hurst, psychologist. Today's topic is going to be a very basic, very simple intervention for panic, and in some cases actually to prevent, but other times, if it comes on, to be able to intervene. But first, props to help understand what's going on with most panic. The key here is that part of what happens when we're stressed, if we have a phobia, we know what we're afraid of. With panic, it tends to or seems to come out of the blue. And so you don't know what it is that's causing it. But I'm going to focus in this on one particular reason why probably most panic happens. The key here is the way the body reacts to stress or fear, uncertainty. We have this, what's called a sympathetic nervous system reaction. It's kind of the low end of the fight or flight. And because what happens when there's full-blown fight or flight, the heart rate goes up, the breathing gets fast and shallow, the blood pressure goes up, all of those things. Talked about it in some other videos. But when there's quite a bit of stress, when the mind is preoccupied with something that's going on, a real easy thing to happen, a typical physical thing to happen, is that people's breathing gets shallower because our mind is focused on the threat or the thoughts or not even, if it's not directly on it, just the background stress level. And so the breathing gets shallow. Now, a way to simulate this is get yourself a straw or a pen, one that you can take apart. Saw this at a workshop, loved it, I've used it for years because it works so well to help people understand. You take one of the tubes, the one that has an open, like in this case, I can't get that thing out, but so I take this in, put it in your mouth, plug your nose, and breathe through it for a minute. You can do it with a straw. It's a little bit bigger hole. It works okay. Might take a little longer. Do all your breathing through this. Now, if you're like the typical person, you won't make it a minute. You might even start to feel a panicky feeling coming on. You can't get enough oxygen into your system. There's a buildup of carbon dioxide, which kicks in this panicky need for oxygen. Well, what people don't understand is that their panic usually results from this shallow breathing without the accoutrements, just from being focused on something else. Problems in a person's life. Had a fellow who started having panic attacks. It was while he was driving. And he just got nervous about other drivers doing crazy things. Well, a lot of possible reasons why people can have panic attacks. But try it. Try it with a straw or a pen tube or something like that. Actually see if you can cause it to happen. Just to understand that not being where you are, not being fully in the now, can get you zeroed in on something else in a way that sets up for panic to just absolutely kick in. Now, one of the other things that I've recently done a video on is sleep apnea. And essentially it's the same thing. Either because of thick neck, being heavy, certain positions, or something going on in the brain that when you breathe out doesn't let you turn the breathing apparatus back on in time, and you get this buildup of carbon dioxide, and people just gasp awake. The key here is diaphragmatic breathing. I've got a video on that I did quite a while ago. Now, if you remember then, if you've seen it, is the diaphragmatic breathing is when your stomach is what you're moving, because the ribs up here, the chest, are hard to move. So your stomach comes out and it draws the diaphragm down, and that's what pulls the air into your lungs. When you pull your stomach back in, it pushes the air out. Now why? I mean, why is that a good thing? It's because this is the breathing that happens when we're relaxed. So if you start to get this edgy feeling, if you start to realize you're preoccupied, you're focused on the stress that's going on in your life at the moment, take a deep, slow breath, hold it for just a second or two, and then let it out slowly. Take another deep, hold it, and then let it out slowly. When you're panicky, this actually isn't very easy, because already your heart's pounding, everything's telling you that there's something wrong, and the breathing is fast and shallow when that adrenaline that's going along with the panic kicks in. But try to remind yourself, wait a minute, let's just see. Really take a deep breath and hold it. And make yourself hold it in for a few seconds, and before slowly letting it out. I taught this, I think I said this in another video, I taught this to a man years ago who was having panic attacks. We never did figure out exactly why, other than he was getting older, and I think that his age, the changes in his life were probably behind it. Anyway, he did well as I coached him through. Came back a week later and absolutely said he'll never do that again. And I wasn't understanding. He said he had done it and it just made things worse. So I said, well, show me what you did. And so he said, I breathe in real deep like you said. Okay, so just show me. Well, I stop. And of course, what he was doing was the same thing. He wasn't getting the air to get exchanged, so the buildup of carbon dioxide was still happening, causing the panic to get worse. And I went, whoa, stop. Now slowly let it out. Let that oxygen get into your system and slow your system down. I mentioned the sympathetic nervous system before. There's another system called the parasympathetic. When you slow it down, when you breathe this diaphragmatic breathing way, it sends a message up to the brain saying, it must be okay out here or I wouldn't be breathing this way. So, I mean, it sounds silly, but it really works. They teach this in anxiety, panic disorders, treatment programs, training programs, and it's so easy, it's so simple, sorta. The real key is remembering to do it, and kind of have some little trigger that tells you when you're getting too preoccupied, when you're getting too stressed, if the uncertainty or the fear is kicking in too much. And take a break. Take that deep breath and then let it out slowly. Sometimes when there really is a lot of stuff going on, it will feel like it doesn't work because it's easy to be impatient. It's not like a switch. You don't take 2 deep breaths and then you're done and you're good now. You gotta really keep it going, slowly letting it out. Give yourself a break. Deep breath in again. Let it out slowly and see if there's anything that you can think of that was just happening or about to happen or going through your mind to see if you can make sense out of why might my breathing have gotten shallow and slow. Often just that stepping back and thinking about, oh yeah, that feeling or that thing I started thinking about, can get you to now step back again and go, okay, what's the right thing to do with this? Try to be where you are in the now, be here now, and make a decision. If you look at the shh video, you'll understand what I mean, because crap does happen, and we can't always know what will happen, but we can become more confident in time that we can get through things. So prevent panic by doing this breathing. Practice it through the day, off and on, 5-6 times a day. Oh yeah, I gotta practice. And spend a few minutes you can't see my bottom hand, but it's going out. A few minutes just settling. Then try to notice if you're starting to get keyed up, if you're starting to get upset, just starting to be preoccupied with something that's bothering, stressing. And do the breathing then as a preventive tool. But especially then if you start to actually get panicky. See if you're in danger. If you're not, try to remember to do that breathing and do it slowly in, well, out, and then in and hold it at the top before letting it out again. Okay, try it. Let yourself, let's say, be not good at it for a while. Think of the racquetball metaphor. It may take 30 days. I don't think it'll take that long. It may take that long to remember to do it, and to remember to do it as a preventive tool, to remember to do it when you're panicking. But do something to help yourself remember, oh yeah, the breathing thing. And practice so that you have the skill down. You're not trying to learn it when you're in the middle of a panic. Okay, I thank you much and hope it helps.